There are 4 things the American Dental Association suggests you do if you want healthy, strong teeth. These 4 things are that you should brush for 2 minutes twice a day, that you should use equipment to clean between your teeth, that you should eliminate sugary drinks, and that finally you should have cleanings on a regular basis at the dentist. In this video, I'm going to tell you the 4 things that I believe you should be doing if you want to have healthy, strong teeth. Now, I'm not in conflict with the American Dental Association. I'm actually going to expand upon what they suggest. That brushing twice a day is a good idea, but what's really important is when you brush your teeth. See, when you brush your teeth, if you're using products that are actually strengthening them and helping them to mineralize, to become denser and stronger and more beautiful and whiter and everything that you want to do this treatment at a time when you're not going to be eating or drinking anything afterward. I always remember a lady that was using the products I recommend, but her teeth looked awful. And it wasn't until I interrogated her, now when do you clean your teeth? I came to find out that she would clean her teeth right before breakfast. Well, that was a waste of time. So my suggestion that twice a day, the first time that's most important, the most important time of the whole day to clean your teeth is right before you go to sleep at night. And the reason for this is because while you're sleeping, when you lie down, the salivary flow, the saliva in your mouth dries up. It becomes more acidic, and it becomes the perfect environment for your teeth to demineralize, to lose minerals, and for plaque to grow. So this is why the most important time to prepare your teeth before sleeping is right before sleeping, and then don't eat or drink anything afterward. Now, the only thing that I would add into that is you could have some xylitol after you've cleaned your teeth. And for children, I believe that is a really good idea because cleaning teeth for kids, we'll talk about that in another video, but it's difficult to do well enough. So you can rely on this last little bit of xylitol right before going to sleep at night. All my grandchildren, we would read stories, munch on some xylitol, and then they would lie down and go to sleep. The other study that was done, if you're pregnant for any reason, you're concerned about your teeth, you can add xylitol right before you go to bed at night. There were studies done in 2022 in Malawi with pregnant women, and they discovered that when they had xylitol gum last thing at night, the very last thing before they went to bed at night, and then again after lunch in the daytime, they were able to reduce the risk of preterm birth. So having a little xylitol after you've cleaned your teeth at night is not necessarily a bad thing. I would recommend a mint rather than a piece of gum. But back to the recommendation to brush your teeth, it's more than brushing your teeth. I believe you need to care for your teeth in an appropriate way, and the most important time right before you go to bed at night for those reasons. And then at some other time during the day, and it doesn't have to be first thing in the morning, and it shouldn't be right before breakfast or eating a meal. It should be after a meal or after a situation where maybe you go work out, you're drinking a lot of liquids after working out, and then do your teeth and do not eat or drink for an hour or so afterward. So when you brush your teeth is, to me, far more important in many ways than just saying brush for 2 minutes twice a day, because my question would be when and with what, and not only the products you use, but the kind of toothbrush you use. Today, everyone is being recommended to use a soft toothbrush, mainly because we're seeing such an epidemic of enamel erosion and gum recession. However, that's on a separate topic. I do not believe going with a soft toothbrush is going to solve those problems for you. And it would not be my recommendation to use a really, really soft toothbrush ever. And I don't think it matters how long you brush your teeth for. My recommendation would be to go work around your mouth. Do it vigorously, do it enthusiastically, do it conscientiously. and give your gums a good massage and your teeth a good clean. And that is the more important thing than saying, oh, I've just brushed my teeth for 2 minutes. The second recommendation of the American Dental Association is to clean between your teeth. And it sounds like a really good idea. Of course, they recommend floss. They are all about floss. However, there have been studies over many years to show that liquids like Listerine do 5 times better job than floss for cleaning between teeth. Now, I have a method of using Listerine to eliminate the problems that occur if you leave a drying alcohol-based mouthwash on your teeth, which I'm not recommending, but I do recommend it is a wonderful way to clean your teeth when you end with a tooth protective last final rinse after the Listerine. And it is only specific kinds of Listerine that I recommend. And I realize if you live in other countries, we may have to find alternatives. But for people who live in America and who are trying to use my system, the products are easily available and they will do a far better job of cleaning between your teeth than trying to do it with a length of string mechanically. Because you can't clean right at the very back of your teeth, an erupting wisdom tooth. There are very difficult teeth to clean with floss, and it's so easy to damage the gums, to cause recession, to push bacteria into your bloodstream. I would not recommend, I never have recommended, I don't personally floss. I use other methods to clean between my teeth. And then the other thing to consider is that if you are using xylitol in an adequate fashion, a little bit of xylitol after every meal and perhaps last thing at night, you will eliminate the bacteria that develop plaque. So you won't have these plaque deposits that you're trying to eliminate between your teeth. There won't be plaque there. So that is another way of cleaning between your teeth, to actually get rid of plaque by eating a little bit of xylitol, because what happens is the xylitol will feed the good bacteria and they will take the place of the bacteria that we have worried about for the last 100 years. It's such a simple way to change the bacterial composition of your mouth and help you to enjoy oral health without the need for flossing. The third thing the American Dental Association recommends is that you should eliminate or limit sugary drinks. I would say to you that we need to really focus on not only the sugar. I mean, sugar is going to feed plaque bacteria, but acidity is going to push the bacteria in the wrong direction. So any drink that is acidic would be in that category, in my opinion. That would be sparkling water, diet sodas, all kinds of alcoholic drinks. All are going to push the biofilm of your mouth in an unhealthy direction. The more often you sip these drinks, the more that's going to occur. In addition to that, even if you sip water, good spring water, pH balanced, everything you want, the problem is you are diluting, you are thinning the saliva, the liquid that is naturally occurring in your mouth, that is designed to repair your gums and heal your teeth between meals. See, when we eat meals, almost everything that we eat and drink it's every carbohydrate, all sugars of any kind, natural in fruits or added sugars in products. Any carbohydrate of any kind will break down to form sugars. Any dairy products in some mouths can break down and cause a fermentable lactic acid that can be damaging to teeth. So there are so many things in foods. I prefer to say eat and drink at meal times. Try to do that in a reasonable 15-30 minute window, and then have a nice drink of water to wash your mouth. Then have some xylitol to alkalize your mouth and get rid of any acidity from the foods that you have been eating, to get rid of any sticky sugars that might still be on your teeth. And the other option is to use something like my Complete Mouth Care system at the end of that meal, because you can, because the first rinse eliminates the acidity and allows you to brush safely directly after a meal. So by not focusing so much on eliminating sugars, which is really hard to do, you really will have a tough time trying to control your oral health by eliminating sugar. It's a very difficult thing to do. If you are more like me and want to just eat and drink and enjoy fruits and bread and vegetables and everything else without too much concern and worry, eat them and just make sure that you end with the tooth protective food or ideally some xylitol. And then you don't eat or drink for an hour or so between meals. This is good for your blood glucose levels. It's also good for your oral health. It allows your teeth to repair and remineralize and build themselves back from the breakdown that occurred while you were eating. Nothing beats your own saliva for rebuilding your teeth. And saliva stimulated by xylitol will be at a slightly higher pH and with more minerals than even normal resting saliva. So the last thing on the American Dental Association list is that you should go for regular cleanings. Now, if you look after your mouth in the way that I have recommended, there is a very good chance that you will eliminate the formation of plaque completely. If you are using the kind of toothbrushes that I recommend that are more dense and more resilient and do a better job of massaging your gums, and you are using the products to care for your teeth in the way that I recommend, there's a very good chance that you can go to the dentist and ask them, do you need a cleaning? And if you don't need a cleaning, there would be no reason to have a cleaning. I decided I would experiment, this was back in the 80s, and see how long I could personally go going to the dentist and asking that question, do I need a cleaning? And it went the first year, and then it was 2 years, and then I went 5 years, and so it went, and I have all the way through my career gone to other dentists to have them check my mouth to look for periodontal pocketing, to look for cavities, to take x-rays, to check things. As we've gone along, we now have testing that can be done. And the answer I get, even very recently, was that I don't need a cleaning. And so I haven't had a cleaning now in over 40 years. And my children go about once every 5 years. They find it's difficult. Sometimes there's a little bit of tartar or calculus, and that's fine. But cleanings every 3 months, every 4 months, if you don't need them, is not a benefit to the biofilm development that is protective of your teeth and your gums. And I think in the long term, we're going to look back when people start actually doing studies on mature biofilm, that they are going to see that as your biofilm, this is the bacterial layer that grows and develops over your teeth, is an incredibly positive thing that we shouldn't be just stripping off teeth every 3 or 4 months because somebody came up with that idea. There is no science anywhere to show a different outcome dependent on the number of cleanings you have a year. And that is why, if you're struggling to save money to take your children to the dentist for cleanings, if it's not necessary, I feel bad for you. And I think you really need to ask that question, do I need a cleaning? If you do, you do. And you allow your dentist to show you where you need perhaps to brush more thoroughly. So those are the 4 things. I'm expanding somewhat on what the American Dental Association say, but I do agree how you brush and when you brush is critical. The kind of brush you use, how you clean between teeth. I would ideally have you use xylitol in my system of mouth care. The way that you can actually control sugar and acids and foods between meals, I think is critical, especially for children with cavities. We'll have a separate video on children's care, but xylitol is a key component, and keeping children from sipping sugary drinks all day is essential to protect their teeth. And then finally, to get to the point where you feel so empowered that you can go to the dentist and ask the question, do I need a cleaning? And feel really, really good about the fact that when they turn around and say to you, well, actually, your teeth look great. No, you don't.